the collaboration. One of the things that I didn't even think about, one day I was walking by our dental clinic, and our behavioral health consultant was over in the dental clinic because one of our dental patients was having an anxiety attack about being at the dental clinic. So they were in there working. And so now our dentists know that that's something that they can call on. I believe this improves the financial stability of both organizations. Indiana's had some cuts on the community behavioral health center side. We're able to do some of those services for them that they were cut. It also improves the efficiency of our medical providers. Instead of them having to, a doctor or a nurse practitioner, having to spend extended time because they thought that this patient here was for strep throat, but it was really a mental health issue, they can call in right there on the spot a behavioral health consultant to work with that consumer. Our electronic health records. It's a little bit easier when they're here at HealthLink. We have both the behavioral health and the mental health providers using the same electronic health records, so they can see everything. At Porter Stark, what we've had to do is use for medical side, use our medical EHRs. So we hooked it all up at their system. We print off the encounter form and the report and scan it into Porter Stark. So we need to work to make that more streamlined. I've talked about finding the right staff for the opportunities. And this assignment of the consumers to the primary care provider other than HealthLink, but we're able to get over that issue. Again, for the severely mentally ill population, we went to Medicaid. We made, from the financing, this is actually a very easy thing to do. We made it a site under our grant. We bill the nurse practitioner or primary care physician at our enhanced FQHC rate, and that also includes our nurse care manager that we bring over to at Porter Stark. The Porter Stark Services uses the Medicaid rehab option for the case management that they're doing with the chronically mentally ill. At HealthLink, the behavioral health and the primary care, we bill with the 96150 codes. What we do with our uninsured, they only pay for the one visit on the medical side, and we write off the other visit for the behavioral health side. It improves our productivity. Again, our providers aren't dealing with, they're dealing with the physical side and not